has been a very important part of creating and making available India's healthcare to the world. During the pandemic, India has amply shown ability to not only produce but also to supply to the world, not only the essential medicines but also the vaccines. We are here to discuss about the healthcare. And whenever a person needs a treatment, he wants to go to hospital. But hospital and hospitality, they are the words which we should actually understand. All of you have come from different parts of the world here today, and you are saying and enjoying the hospitality of India. And I think that is what is there in our hospitals. So it's not only a medical treatment facility, but a treatment facility full of hospitality. And I think one thing we all know as medical professionals, that there are two parts of that. One is we need to treat a patient, give him a medicine, maybe operate it or give some treatment, but more importantly, give a psychological well-being to him and her. And I think this is something which is very much in our healthcare system. So it's my pleasure to welcome you all to this deliberation, and I'm looking forward that India can even contribute much more in the MVT in time to come. Thank you very much.
May I request Dr. Azad Mupan, Chairman, Aster Group of Hospital, to speak.
Honorable Health Minister of India, Dr. Manshik Pandivati, Honorable Director General of WHO, Dr. Tedros, other ministers, officials, ministers from abroad who have come here, industry stalwarts, and delegates. To me, it's a great honor to be here, slightly different from the industry from India, because I am also sitting outside of India and watching what is happening in India. India is a story which is beyond recognition when you look at it. What has happened in the last 15-20 years in the Indian healthcare industry is tremendous. It's not that we attract patients for medical value travel to India, which we used to do anyway, but there is also a lot of enthusiasm in the last 5 years after COVID, the way in which India could support the world, the way in which we managed COVID, as well as the way in which we supported the world. So India has that potential. Indian doctors, as you know, are across the world, and they are the ambassadors of India, the nurses as well as doctors. So India also has the traditional systems, like the Ayurveda, which started 2,500 years back, and yoga even before that. So the difference of India, when you look at other countries in the area of healthcare, is that India is a country which can provide holistic care, while others can provide maybe a particular system, mostly modern healthcare. India is one country which is possible to provide care in different, the Ayush 7 areas, as well as medical care. And millions of patients are coming to India, and it's going to increase. So the advantage, three things. One, the cost differential. There is significant cost differential, but more importantly, I should stress that it is not the cost, it is more importantly the quality of service that India is providing now. And that is increasing. With 42 JCI accredited hospitals and thousands of NABH accredited hospitals, India is at the top when it comes to quality healthcare. And I'm sure that this will be recognized by the world. And we are looking at partnership with countries around us, especially in this region. And we will be extremely happy to provide facilities for training as well as cooperation with all those who are there from the nearby countries. Thank you very much. Thanks a lot, FICCI, for this opportunity. May God bless. Thank you. Jai Hind.
Now I request Sri Sudhansh Pant, Secretary, Minister of Health and Family Welfare, Government of India, to address, please.
Namaskar. Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers, Shri Dr. Mansukh Bhai Mandviya ji, Honorable Union Minister for Port Shipping, Waterways and Ayush, Shri Harbanand Dhonowal ji, the Director General of WHO, Dr. Tedros, our Honorable State Minister for Health, Professor S.P. Singh Baghel ji, Honorable Minister of State for Health, Honorable Bharti Praveen Pawar Madam, Honorable Minister Shri Rushikesh Patel ji, Honorable Member Niti Ayog Dr. V.K. Paul ji, Shri K. Vardhan Rao ji, Shri Pankaj Bhai Patel ji, Sangeeta Ben Reddy ji, Shri Azad Mukan ji, Shri Sharad Agarwal ji, all the distinguished officials from various ministries, our guests from 69 countries around the world, other distinguished participants, esteemed members of the media, ladies and gentlemen. At the outset, I feel honored to welcome all of you to this One Earth, One Health, Advantage Healthcare India event today. This event hopes to promote collaborative healthcare efforts across borders, knowledge sharing and capacity building amongst the countries and various healthcare providers. It is a fact that certain geographies do not have all the complex treatments available at all times. Even if they are available, the cost is prohibitive and the waiting times could be high. Hence, we need to work together to improve the patient outcomes and focus on patient centricity. An inclusive health system can be achieved when the patients are empowered and they have the choice to choose from a comprehensive range of services, including medical consultation, treatment, post-operative treatment, and follow-up care, cutting across the geographical limitations. This involves value-based healthcare services supported by the framework of medical value travel. Another challenge is with respect to the varied levels of skilled health workforce across different countries in the globe. This necessitates creating a structure to facilitate health workforce skilling and their mobility across the territories, which would result in effective and timely services. One Earth, One Health event celebrates the interconnectedness of citizens, bound by our common vision of healthcare for all. I would like to thank all the distinguished delegates for their presence and urge them to work towards developing an ecosystem where healthcare becomes available to all in an accessible, affordable, and equitable manner. Come, let us all work together to move towards one earth, one family, one future. Thank you. Jai Hind.
May I now request Dr. Bharti Praveen Pawar ji, Minister of State for Minister of Health and Family Welfare, Government of India.
Thank you. Dr. Mansukh Mandviya ji, Honorable Minister of Health and Family Welfare, Honorable Minister of Ayush, Shri Sarbanand Sonowal ji, DG WHO Dr. Tedros, Shri S.P. Singh Baghel ji, Shri Rishikesh Patel ji, Shri V.K. Paul ji, Shri Sudhansh Panji, Shri Kamalvardhan Raoji, distinguished health ministers, respected delegates and invitees. On behalf of the Ministry of Health and Family Welfare, Government of India, I feel honored to welcome all of you to the One Earth, One Health, Advantage Healthcare India event. This G20 co-branded event is focused on fostering cooperation on value-based healthcare through medical value travel and health workforce mobility as an essential component of achieving the aim of healthcare for all. In present times, the concept of health needs a holistic approach, and I would like to specifically touch upon the need for integrated medicine and the role traditional medicines can play. Under the dedicated and competent guidance of Honorable Prime Minister of India, Shri Narendra Modi ji, India is committed towards promoting this integrative approach. India has the unique advantage of offering traditional healthcare therapies or AHCI treatments for the purpose of well-being to medical value travelers from across the globe. People from around the world can come to India for a transformative journey that encompasses physical rejuvenation, mental peace, and spiritual growth. Excellencies, our government is working towards establishing separate wings for integrative medicine in all hospitals of the country. Integration of traditional medicine and modern medicine is an essential aspect of achieving affordable and accessible healthcare for all, especially in remote areas. It is important to also focus on challenges posed by mental health issues for a healthy living. India has recently launched a tele-mental health assistance initiative called Telemanas, which provides telecounseling on mental health issues through a network of 23 tele-mental health center of excellence across the country. Event such as this can be a forum for sharing best practices and to facilitate global cooperation. As we embark on this journey together, let us utilize this convergence of innovation and compassion to forge stronger bonds, ensuring healthier tomorrow for all our citizens. Thank you so much. Dhanyavad. Jai Hind.
Can I request Professor S.P. Singh Baghel ji, Minister of State for Health and Family Welfare, Government of India, to address.
Honorable Minister of Health and Family Welfare, Dr. Mansukh Mandaviya ji, Honorable Minister of Ayush, Sri Sarvanand Sonwal ji, Director General of WHO, His Excellency Dr. Tedros, MOS Ayush, Sri Mahendra Bhai Kalu Bhai, Honorable Minister of State for Health, Dr. Bharati Praveen Pawar ji, Sri Rishikesh Patel, Health Minister Gujarat, Dr. V.K. Pal, Member Niti Ayog, Sri Sudhansh Pant, Secretary Health, Sri Kamala Vardhan, CEO, Distinguished Health Minister, respected delegates and invitees. Good morning, and I extend a very warm welcome to all of you, Excellencies. Universal health coverage is defined by the United Nations as making available a full range of quality health services without financial hardship. I can proudly say that under the able guidance of the Honorable Prime Minister Shri Narendra Modi, India is fast achieving this goal by launching the Ayushman Bharat scheme in 2018. It is the largest publicly funded health assurance scheme in the world, which provides health cover of rupees 5 lakhs, nearly 6,000 US dollars per family per year for secondary and tertiary care hospitalization to more than 100 million vulnerable families. Universal health coverage is not limited within the territorial borders of a country. India holds the vision of One Earth, One Health. We intend to provide health services to other countries through Heal by India and to those visiting India through Heal in India. As part of universal health coverage, Heal in India intends to promote medical value travel (MVT) or medical tourism in the country by providing medical treatment, wellness and rejuvenation and cures through traditional system of medicine. The affordability and accessibility of good health care service, facilitation around hospital services, minimum waiting time and availability of latest medical technologies have helped India rank 10th in the Medical Tourism Index for 2020 and 2021. We must recognize the power of MVT as a strong economic tool. It has the power of increased revenue, employment, opportunities, and foreign investment apart from having a certain spillover effects, such as rise in living standards of people associated with tourism growth in certain industries, demand for related educational course, etc. MVT facilitators are critical link between patients and healthcare providers. They help patients by streamlining the process and ensuring a smooth experience for medical tourists. At the heart of MVT are the healthcare institutions and practitioners who deliver specialized treatment and procedures. We must create synergies across the stakeholders, hospitals, medical facilitators, insurance companies, healthcare associations and government bodies to facilitate a global healthcare network with patient well-being at its core. Let us all come together to open our healthcare services system to every citizen across the globe and create an equitable, accessible and affordable service delivery mechanism. Jai Hind.
May I take this opportunity to invite Sri Sarbanand Sonowalji, Honorable Minister of Ayush and Ports, Shipping and Waterways, Government of India, to give his special address.
Thank you. Namaskar. Good afternoon to you all. Honorable Indian Minister of Health and Family Welfare, Government of India, Dr. Mansukh Bhai Mandaviya ji, Honorable Director General of WHO, Dr. Tedros, Honorable Indian Minister of State for Health and Family Welfare, Srimati Bharati Prabin Pawarji, Honorable Indian Minister of State for Health and Family Welfare, Professor S.P. Singh Baghel ji, Honorable Minister of Health, Government of Gujarat, Shri Rishikesh Patel ji, Dr. B.K. Paul, Honorable Member, Niti Ayog, respected Secretary, Health and Family Welfare, Sudan Panji, respected G. Kamala Badanji, respected dignitaries, guests across the globe, ladies and gentlemen. With a great pleasure, I welcome all gathered here for this milestone event on this culturally gifted and industrially important land of Gujarat. India started the journey of its G20 presidency under the visionary leadership of our Honorable Prime Minister, Sri Narendra Modi ji, with the theme of One Earth, One Family, One Future. We realized the importance of resilient global healthcare system in fulfilling his vision. India sees medical value travel and health workforce mobility as important for a healthy planet. Advantage Healthcare India 2023 is an important effort in this direction. This gathering resonates with India's G20 presidency theme. This is also symbolic of the Indian philosophy of Vasudhaiva Kutumbakam, which means the world is one family. Today, traditional medicine and specifically Ayush have much to offer to the common man, academician and scientist, to industry and to the entire world. The increasing demand for Ayush in India and globally can be seen through the rise in the size of Ayush industry. The manufacturing industry in Ayush has been growing at a CAGR of 17% from 2014 to 2020. The current market size is projected to be $23.3 billion. This is indicative of the growing Ayush ecosystem and its widespread adoption. Considering the same, the adoption of Ayush in public health also seems to be gaining momentum, especially after the pandemic. India is known as the pharmacy of the world, and we have the potential of becoming the world leader in traditional healthcare sector too. Recently, the Ayush sector has played a significant role in supporting the response to the COVID-19 pandemic through the development and dissemination of guidelines and recommendations. Ayush system also emphasized the importance of boosting immunity as a preventive measure against COVID-19 pandemic. The Ayurveda and other Indian traditional system of medicine have age-old acceptance among the communities in India, and in most places, they form the first line of treatment in case of common ailments. With increasing awareness about health and fitness and changing lifestyle, the demand for Ayurveda and its product has increased tremendously at international level. The concerted effort of our Honorable Prime Minister, Sri Narendra Modi ji, have also resulted in declarations of 21st June as International Day of Yoga in UN declaration, and it marks the relevance and significance of our traditional wellness system as an important intervention for ensuring the well-being of entire globe. Last year, Honorable Prime Minister was present here for Global Ayush Investment and Innovation Summit 2022. This summit, he announced for a separate category of Ayush visa to facilitate the medical value travel in traditional medicine. It gives me immense pleasure to inform that a new chapter 11A for Ayush visa has been notified by Ministry of External Affairs, Government of India. The preventive and promotive approach of our traditional healthcare system has played a significant role through centuries in healthcare security of our country. But with increasing socio-economic interdependence and increased mobility between and within countries, this health security has become vulnerable to being compromised, with a resultant impact on global health. The only way to combat The alarming problem is to implement, harmonize, and coordinated strategies of traditional medicine through effective governance at international, regional, and national level. India, being a soft power in the traditional system of medicine, can play a pivotal role here in mitigation of this alarming sense in healthcare scenarios. I extend my gratitude and best wishes for all those who are working tirelessly in achieving the vision of integrative healthcare without any boundaries. Thank you. Jai Hind.
Thank you, sir. Ladies and gentlemen, Minister of Health, Government of India has developed a portal, the Advantage Healthcare India, Patient Mobility and Health Workforce Mobility Portal, a one-stop digital destination aiming to bring together the best of our healthcare services and the warmth of Indian hospitality for international patients seeking medical treatments in India and abroad. May I take the honor of inviting Dr. Mansukh Mandaviya ji to launch the portal.
has always had a comprehensive and holistic approach to healthcare. In line with that, Advantage Healthcare India has become a globally significant brand today. To facilitate medical tourism, India has developed its official portal for medical value travel that serves as an integrated platform of NABH-accredited hospitals and healthcare facilitators, providing the world with a window to access Indian healthcare and wellness services with the click of a button. Presenting the Advantage Healthcare India portal. Designed as a one-stop solution for all your healthcare and wellness needs, offering a seamless and user-friendly experience with end-to-end facilitation. Whether you're a patient, government, hospital, or medical value travel facilitator, this portal is tailored to cater to your specific requirements and is currently available in 4 different languages. Detailed information about various treatments in modern, traditional, and integrated medicine can be found on the portal. If a patient wants to undergo knee replacement surgery, a single click will show them all the doctors offering this treatment along with pricing packages. Each hospital has a dedicated page with details such as beds, specialties, treatments, pricing, doctors, nearby accredited accommodations, and patient testimonials. Once patients select their preferred doctors, their medical reports can be sent with a single click to the connected facilitator and hospital through multiple channels including WhatsApp. It has a range of features that enhance convenience, streamline interactions, offer transparent pricing, and a dedicated grievance redressal mechanism to provide end-to-end facilitation and ensure data security through state-of-the-art encryption. We are excited to welcome you and your loved ones. Start your medical and wellness journey with India.
India has significantly contributed to the growth of medical science since ancient times. The journey of service and excellence is being continued by thousands of Indian doctors, nurses, paramedics, yoga teachers, etc. in India and abroad. Having been educated at world-class facilities in the country, thousands of healthcare professionals move to different parts of the world every year to serve humanity. An integrated portal has been developed for the seamless movement of medical professionals from India to different parts of the world, bringing them closer to the global healthcare market and address shortages of qualified manpower in various countries. The portal will facilitate direct and transparent communication among the stakeholders such as international recruiters, employers, and prospective healthcare professionals. A prospective employer or recruitment agent can search a verified database of healthcare professionals. Healthcare professional, on the other hand, can seek potential opportunities by reaching out to recruitment agents or foreign employers based on professional type and countries they are interested. The portal enhances the trust and transparency by ensuring that only verified entities are allowed to participate in the process. Healthcare professional can connect to recruiter agent, foreign employer to process the application. The application of a professional can be tracked at various stages such as initiated, employer connected, verified, pre-departure orientation, visa or work permit processing, ready for departure, and employment started, thus providing complete transparency. Further, a professional can withdraw her application at any stage. Recruiter and foreign employers can also register in the portal. Effective and dedicated grievance redressal mechanism for all stakeholders is an integral part of the portal. By reducing barriers and increasing trust, India is determined to ensure seamless healthcare workforce mobility.
Ladies and gentlemen, it was Dr. Mansukh Bhai Mandaviyaji who conceived and guided the ministry to organize this conference as part of G20. It is due to his directions we are conducting the largest health conference in this country along with the exhibition. Now I take this as an opportunity to invite Dr. Mansukh Mandaviyaji, Honorable Minister for Health, Family Welfare, Chemicals and Fertilizers, Government of India, to deliver his inaugural address.
Present with us today, my cabinet colleague, Shri Sarvanand Sonwalji, Union Minister of Ayush, Port, Shipping and Waterways, Dr. Tedros, Director General, World Health Organization, my colleague Minister, Shri S.P. Singh Baghelji, and Dr. Bharti Praveen Pawarji, Health Minister of Gujarat, Shri Rushikesh Bhai Patel, Member Niti Ayog, Dr. Polji, Secretary Health, Honorable Health Minister from around globe, delegates from all corners of world, representative from industries, association, and esteemed participants. It is immense pleasure to welcome my brothers and sisters from the healthcare fraternity across the globe to the One Earth, One Health Advantage Healthcare India event. I am honored to address representatives from more than 70 countries, including CIS countries, ASEAN countries, SAARC countries, African countries, and the Middle East region also. Excellencies, under the able leadership of our Honorable Prime Minister, Shri Narendra Modi ji, India has been moving steadily towards the goal of Sarvodaya, truly focusing on achieving universal health coverage through more than 150,000 health and wellness centers and what's biggest government-funded health insurance scheme, Prime Minister Jan Arogya Yojana, and through Antyodaya, which is about service to the most vulnerable. While undertaking this transformative journey with India, we are also making consistent effort to contribute to the global healthcare ecosystem. Today, India is known as the pharmacy of the world. It is the largest provider of generic medicines globally and has a share of 20% in the global supply volume and contribute to around 60% of global vaccines. Through the Vaccine Maitri initiative, India has supplied over 298 million COVID-19 vaccines to around 100 countries, which shows our commitment to the global community and dedication to help our brothers and sisters in all parts of the world. Friends, this event focuses on promoting value-based healthcare through medical value travel, which has steadily evolved into a powerful force offering numerous benefits to patients, countries, and health systems. Patients can travel to any part of the world to access specialized treatments, renowned medical experts, and cutting-edge facilities that might otherwise are not available or beyond their reach. For India, health is a service and never commerce alone. We have been working towards creating a people-centric, value-based systems of healthcare. India's medical value travel sector is projected to reach $13 billion in 2026. This is supported by India's aims of creating a borderless world, where patient mobility is facilitated through enabling technology and people can travel to any part of the world to receive treatment. Excellencies, the nation's health system is presently supported by a workforce of 1.3 million allopathic doctors, 8 lakhs AHCI doctors, and 3.4 million nurses and auxiliary nurses and midwives. Through this highly qualified and skillful workforce, India plans to contribute to an organized system of workforce mobility, wherein India's healthcare professionals travel to different parts of the world to serve the global community. I am eagerly looking forward to the session on success stories of medical value travel in India and leveraging the power of partnership through MOUs, which will create the foundation for greater knowledge sharing, sustainable partnership, and increase synergies. The launch of India's one-stop digital portal for patient and workforce mobility shows us that a global revolution in healthcare basis on mutual collaboration and mutual trust is not far behind. The launch of these two portals is not just a milestone for India, but significant step toward fulfill our global responsibilities. India has always been at the forefront of healthcare innovation, and these portals are testament to our dedication to improving the lives of people around the world. Through these portals, we are offering a tangible solution to some of the most pressing challenges in healthcare today. We are demonstrating our commitment to building a more inclusive and equitable world where healthcare knows no boundaries and well-skilled healthcare professionals can make a difference wherever they are. Advantage Healthcare India reflects India's unwavering commitment to achieving universal healthcare coverage and ensuring that no one is left behind in the journey toward better health. I would like to congratulate the team which created these portals for facilitate both medical value travels to India and facilitate human resources mobility. Value-based healthcare truly illustrates the guiding philosophy of uninitiated in Indian scale text Vasudhaiva Kutumbakam, which means that whole world is one family and sarve bhavantu sukhinah sarve santu niramayah, meaning that may everyone be happy, healthy and free from sufferings. One Earth, One Health, Advantage Healthcare India holds substantial power to forge a unique blueprint for the future of medical tourism and health workforce mobility through well-directed efforts as effective collaboration. Our collective efforts will be towards creating a healthcare ecosystem that embraces the voice of every nation, every citizen, and every being. Thank you. Thank you very much.
Thank you very much, sir, for your inaugural address and for your message and direction. Ladies and gentlemen, before we conclude the inaugural session, I request Dr. Tedros Adhanom Ghebreyesus, Director General, WHO, to address.
Thank you, moderator. Excellency Minister of Health, Excellency Minister of Ayush, Excellencies, I would also like to recognize the presence of the private sector. Thank you so much for inviting me to this very important meeting, One Earth, One Health, and also Heal in India and Heal by India. Namaste. I think it must be Madam Sangeeta Reddy who said many Indian doctors all over the world. It's true, but at the same time, during my time when I was high school student, there were many Indian teachers in Ethiopia. And what I remember from that moment is especially not only what they taught me as a high school student, but what they taught me about Ayurveda. That's the first time I heard about Ayurveda and about the huge potential of India's traditional medicine. And I said it last year when we inaugurated the WHO Global Center for Traditional Medicine, that, especially for me, it was a very personal one, and links between my exposure when I was a student. And as you can see, Indian doctors, Indian teachers, I can see that they're your ambassadors. So I fully agree with what you said. This is a great opportunity for India. And especially with medical tourism or the medical value transfer, it can give you a huge advantage. I think many of you have said it, and I don't want to repeat. But of course, countries would like to invest in their own health system to build their own. And I don't think the idea of medical value travel or medical tourism contradicts it. It can be done while building national capacity. And of course, we have to build our capacities, but at the same time, maybe each country may not cover everything. And there could be countries that may specialize in some areas that can help in medical tourism. In some countries, maybe the service is not accessible or is not available, I mean. When I was Minister of Health, one of the agreements we signed with Apollo hospitals was exactly that. And I remember many Ethiopians coming to India for medical reasons. And compared to other countries, the experience I know is that it's more affordable. So with medical tourism, affordability can also come, as has been said. Quality could also be there. And for some countries, like what I said about my country, it could be because of lack of availability of that service, and people will definitely go, and patients will migrate to get or travel, or the patient mobility that we say, people will move to seek service. So what I'm trying to say is it can go side by side while building national capacity in the country. And then the other point that I would like to comment on is the digital portal. One-stop digital portal, as has already been presented, can really help, and as presented. But not only to identify the services, to see the service packages, to see the price, and so on. Investing in digital technology is very important because the services that can be provided from India could also be virtual, meaning telemedicine. By the way, I have seen it happening in Ayushman Bharat Wellness Center yesterday, how a community health worker in that center was communicating with a doctor 40 kilometers away and managing a patient. So that can also be done globally. So there could be things that can be done through patient movement. There could be also areas that can be done through telemedicine. So it can even help the patients who cannot afford to travel long distances. Of course, some services will need a travel, will be a must, but there are also services that can be handled through digital technology. But I would like to use this opportunity to thank India for its leadership on digital health, especially in India's G20 presidency. One of the initiatives that India led is on digital health, and we're working closely with India, and I hope that will bring opportunities for the world. But I would like to also raise that issue and recognize India's leadership in digital health as its G20 presidency. So thank you so much again for inviting me. I fully agree with what Minister Mankush said. Whole world is one family, and we hope the medical value travel or the medical tourism will be one opportunity that will bring the world together, and also use the opportunity or the potential that India has. So namaste And thank you very much.
Thank you, sir. Thank you very much. Ladies and gentlemen, for proposing a vote of thanks, I invite Ms. Aradhana Patnaik, Joint Secretary, Minister of Health and Family Welfare, Government of India.
Distinguished delegates, Namaskar, a very good morning to you all. On behalf of the Ministry of Health and Family Welfare, Government of India, I would like to extend my gratitude to you all for being present on the inaugural session of the One Earth, One Health Advantage Healthcare India event and sharing your valuable inputs with us. We look forward to a day of collaborative discussions and fruitful engagements. I would like to thank Honorable Minister of Health and Family Welfare, Mansukh Mandavia ji, and Honorable Minister of Ayush, Sarbanand Sonowal ji, for gracing this occasion and reiterating our commitment towards creating an affordable and accessible global health system. We are grateful to the esteemed Director General of WHO, Dr. Tedros, for his powerful words and strong resolve towards achieving the goal of universal healthcare. I express my appreciation towards Honorable Ministers of State for Health, Dr. Bharti Praveen Pawarji and Professor S.P. Singh Baghel ji, for highlighting such critical aspects of healthcare and leaving us with so many points to ponder on. Lastly, I would like to thank Honorable Health Ministers and delegates from around the world for taking out their valuable time to be with us today. We look forward to your insightful contributions in the numerous sessions we have lined up for today, including the regional roundtables, which focus on promoting partnerships for a healthier future, skilling and human resource mobility to aid health service delivery, and many more. Thank you.
Ladies and gentlemen, we conclude the inaugural session now, and I request all the dignitaries and the delegates to move towards the inauguration of the exhibition outside this building. And it will be inaugurated by our Honorable Union Minister for Health, Dr. Mansukh Mandavia ji. Thank you so much.
Thank you so much once again to all the dignitaries and speakers and friends of media who have joined us today over here. I now invite all the dignitaries to join us for the inauguration of the GCTM exhibition at the Exhibition Hall 1. All the other delegates and hosted delegates are
Warehousing Development and Regulatory Authority, Mr. Amit Kumar Singh,